Namaste. Hello, friends. I am Dr. Prabuddha Mukhopadhyay from Kolkata. I am Associate Professor in Vivekananda Institute of Medical Sciences. Today, I shall talk regarding some recent updates on hypertension. As per WHO, nearly 63% of total deaths in India are due to non-communicable diseases, of which 27% are attributed to cardiovascular death, which affects 45% people in the 40 to 69 age group, that is productive age group. Raised blood pressure is among the most important risk factors for cardiovascular deaths. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow-up. In India, the prevalence has also gone up over 30 years to 38% in men and 32% in women, from 29% and 28% respectively. As data from WHO. Despite that, nearly half of the people, or 51% of men and the 41% of women with hypertension, were unaware of the condition. Additionally, over 62% of men and more than 52% of women living with hypertension did not get treatment. Medication was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women with hypertension worldwide. Friends, the AHA-ACC has released a scientific statement in 2021 offering new guidelines for management of stage 1 hypertension among patients with low ASCVD risk. Among low-risk adults, the no ASCVD for 10 years CVD risk less than 10%, with stage 1 hypertension, blood pressure 130 to 139, and diastolic blood pressure is 80 to 89 millimeter of Hg. Management starts with non-pharmacologic therapy. If blood pressure remains uncontrolled at 3 to 6 months, consider starting pharmacologic therapy. It's evidence-based. Lowering systolic blood pressure targets down to the 110 to less than 130 millimeter of Hg ranges substantially reduced CV cardiovascular adverse events in the STEP randomized trial, affirming the sprint findings for an older Chinese population. Among some 8,500 patients ages 60 to 80 in China, the intensive target trimmed 26% of the composite CV risk. Finding from now a second major trial supporting a lower target could unite the guideline, which even among US professional societies ranges from thresholds of 130 to 150 millimeter of Hg. With regards to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure, the 2018 European Guidelines on the Management of Arterial Hypertension recommended that the diagnosis of hypertension should not only be dependent on office blood pressure measurement, but also on out-of-office measurements such as ambulatory blood pressure monitoring, ABPM, or home blood pressure monitoring, HBPM. 24-hour and nighttime blood pressure measurements were associated with greater risk of mortality, a composite CV outcome. Thus, they may be considered as the most relevant measurement for estimating cardiovascular risk. For every 20 to 10 millimeter of Hg increment of blood pressure measured at night, the risk of mortality increased by 23% and the risk of cardiovascular events by 36%. Most patients with hypertension require lifelong medical therapy to achieve optimal blood pressure control. The 2018 European Guidelines equally recommended 5 classes of antihypertensive drug considering high non-adherence of treatment. The importance of combination treatment is particularly highlighted to improve adherence to therapy and BP control. Therefore, in 2018, European guidelines recommend, especially the context of lower BP targets, to start antihypertensive therapy with an initial dual fixed dose combination, that's ACE1 or ARB plus CCB or diuretics. So, friends, hypertension control, specifically nighttime blood pressure management, is very important, and adequate and proper use of medications in timely manner is the key factor to reduce the blood pressure and to reduce finally the cardiovascular death is very important in now the recent days management of blood pressure. Thank you for listening. Thank you. Thank you, everyone.